I think there's some differences in regulatory process. I don't understand exactly why. I mean, the UK in some cases has been, the UK regulator in some places has been criticised for being too fast. So I don't think we can say the EU is too slow. I mean, every regulator has to follow their due process. So I think that's fine.
Well, it appears Germany's concerns are more over the lack of data among older groups rather than possible adverse effects of the AstraZeneca vaccine.
Yeah, so this goes back to the history of the way that the clinical trials were run. In the Oxford clinical trials deliberately chose to use large quantities of younger people to assess fully the safety before moving into vaccinating larger groups of older people. What that means is, on a practical level, is it takes longer for us to get data on the older populations. So it's not that we have any reason to believe that the vaccine isn't effective in older people. There just isn't as much data. So it's entirely reasonable for the German Vaccine Committee to make a decision, especially if we mustn't forget that there is another vaccine available. So it's not that they're saying the vaccine won't work. They're just saying that they want to wait and see the data.
Well, AstraZeneca and Boris Johnson have strongly defended the vaccine, which has already been widely used in Britain on older people. What else are they saying about its safety?
So the safety data is very clear for all of the vaccines so far. There's no adverse effects associated with them. The point is that what we do know about older people is that the immune response to the AstraZeneca vaccine is, as far as we can see, as strong as it is with younger people. So everything that we know about the way the immune response works would suggest that it is also protective. It's just the lack of clinical trial data, which we'll see that data in the coming weeks and months.
Well, Britain's already also defending its decision to extend the gap between the first and second dose. Do you agree that getting the second dose 12 weeks after the first rather than 3 to 4 weeks after shouldn't affect efficacy of any of the vaccines being used in the UK at the moment?
So immunologically, it shouldn't make that much difference, and it's common practice with quite a lot of other vaccines to have, longer time between different doses. So it's a really difficult decision, and I think what you've got to bear in mind with that decision is that here in the UK, we're facing incredibly high case rates. We're facing very, very high mortality and morbidity and massive pressure on our health systems. So it really isn't an ideal situation to be making decisions. So it's under that enormous pressure that the decisions have been made.
And how long before we start to see the vaccination program in the UK have an impact on case numbers?
Yeah, so that's what everybody's holding their breath for. So there'll be two different things. First of all, the vaccine we know is good at protecting from infection and disease. What that means is that we might start to see, as the more vulnerable populations, we hope to see a reduction in really seriously ill people and deaths. But that won't necessarily affect the spread, because you actually need to have a very high level of protection in a population to prevent spread. So we're still faced with months of very high infection levels. Hopefully what we'll see, though, is that the consequences of the high infection levels will become less severe, and it will present less pressure on our health services, and of course less people will be dying.
We're also hearing today that the Novavax vaccine appears to be 89% effective. Why are you excited about these results?
Yeah, so it may not seem like such a big deal. We've got a number of vaccines already approved, but actually to immunologists and vaccine manufacturers and vaccine discoverers, this is really exciting news, because it's a different type of vaccine than the existing vaccines that we already have trial data for. So if you remember, we've got RNA vaccines like the Pfizer and Moderna vaccines. We've got viral vaccines like AstraZeneca and some of the other ones from China and Russia. But this is what's called a subunit vaccine, which means it's just a tiny fragment of the virus produced in cell culture and then purified and formulated. And that works as well. So that's really actually groundbreaking, because it means we really have lots and lots of different tools at our disposal.
Always good to have all these different options. Meanwhile, Boris Johnson apologised this week for the 100,000 lives lost to COVID-19 in the UK, saying his government did everything that it could. Do you agree with what he was saying?
So, we are where we are. And I think looking back, I think that there's a general feeling that on a number of occasions, restrictions and particularly lockdowns were left too late, whether that's last March or maybe just before Christmas, in the sense that by the time we actually had restrictions, infection levels have been very, very high. And that's what we're suffering with right now. We have, anything up to 1 in 50 people in the UK infected. And if we'd had a restrictive lockdown earlier, there's no doubt that there would be lower levels of infection. Having said that, it's a very difficult situation, and everybody's trying to balance very hard political decisions against clinical needs. So, maybe mistakes have been made, but at the end of the day, this is where we are now, and this is what we have to deal with.
Indeed. Well, all the best. Hope the situation does improve there. Dr. Alexander Edwards, thanks so much for joining The World.
Thank you.